The sugar story. Imagine your body is a bustling city. The millions of tiny apartments in this city are your cells. Just like people need energy to go about their day, your cells need energy to do their jobs. The main source of this energy is a type of sugar called glucose. Glucose comes from the food we eat, especially carbohydrates like bread, fruits, and pasta. It travels through your bloodstream, the city's highway system, ready for delivery to every cell. But glucose can't just walk into the cells on its own. It needs a special key to unlock the door. That key is insulin, a hormone made by the pancreas, the key factory. When you eat, the pancreas releases insulin keys that unlock cells so glucose can enter and become energy. If the key system fails, glucose gets stuck on the highway. Blood sugar rises. This is hyperglycemia, high blood sugar. Over time, it damages blood vessels, nerves, the heart, kidneys, eyes, and feet. Understanding insulin as the key to moving glucose into cells is the first step to understanding diabetes. While the ending, high blood sugar, may be the same, the reasons are different. Side by side, causes, onset, symptoms, and treatments. Type 1. The key factory has shut down. An autoimmune process gradually destroys insulin-producing beta cells, often appears in children or young adults and can cause sudden symptoms. Extreme thirst, frequent urination, and rapid weight loss. Type 2. The locks have become rusty, insulin resistance. The pancreas often makes extra insulin to compensate, until it can't keep up. Type 2 develops slowly and is linked to obesity, poor diet, lack of activity, and genetics. Compare key features. Type 1, often sudden, requires insulin. Type 2, gradual lifestyle first, then meds, sometimes insulin later. Management differs. Type 1 needs insulin replacement. Type 2 focuses on lifestyle, oral meds, and sometimes insulin. Type 1 is not caused by eating sugar. It's autoimmune. Type 2 accounts for roughly 90–95% of diabetes cases. Now let's look closer at what happens in type 1. Key takeaway: missing versus faulty insulin action. Same result, different cause. Think of your immune system as a security force that protects you from invaders. In type 1, that force misidentifies the insulin-producing beta cells as threats and attacks them. Over weeks to years, the number of functioning beta cells dwindles until insulin production collapses. This can present suddenly in children: new bedwetting, unquenchable thirst, and rapid weight loss. Living with type 1 means supplying insulin externally and monitoring blood sugar constantly. It's a demanding 24/7 job to keep blood sugar in range and to avoid both highs and lows. Insulin resistance is like knocking loudly on a door while someone inside wears headphones. The pancreas floods the blood with insulin to try to get cells to respond. This compensation can keep blood sugar normal for a while, a stage called prediabetes. Risk factors: excess abdominal fat, inactivity, processed foods, sugary drinks, play a major role and are modifiable. Modest weight loss and regular activity can improve insulin sensitivity and sometimes put type 2 into remission. When lifestyle isn't enough, a range of medicines, and sometimes insulin, help manage blood sugar. Diabetic ketoacidosis, or DKA, is a life-threatening complication of diabetes. While it can happen in type 2, it is far more common in type 1 and can be the first sign of disease. In type 1, without insulin, the cells are starving even though the bloodstream is full of glucose. The body switches to an emergency plan. It breaks down fat to make alternative fuel. Fat breakdown produces ketones, acidic molecules that in excess make the blood dangerously acidic. Summary: no insulin leads to severe hyperglycemia, fat breakdown, ketone overproduction, acidosis, and dehydration. High blood sugar causes the kidneys to try to flush sugar out, pulling water with it. This leads to severe dehydration and dangerous electrolyte imbalances. Acidosis causes nausea and vomiting, which worsens dehydration. The body tries to compensate by breathing heavily, small respirations, to blow off CO2. Breath may smell fruity from acetone. Blood or urine ketone tests show high ketones. Acidosis interferes with the function of vital organs, the heart, brain, kidneys, and can be rapidly fatal. DKA can develop quickly, often within 24 hours, progressing from mild symptoms to critical illness. DKA is a medical emergency. Immediate hospitalization is required. Treatment: IV fluids, insulin to stop ketone production, and careful electrolyte and glucose monitoring. With prompt treatment, most people recover, but rapid recognition and care save lives. Recognizing DKA early can save a life. Here are the alarm signs: extreme thirst that won't go away, very frequent voluminous urination, Severe abdominal pain, nausea, and vomiting. Don't dismiss these. Deep, labored breathing, small respirations, is a red flag for severe acidosis. A fruity or chemical-smelling breath often signals high ketones. A very high glucose reading plus positive ketones on blood or urine testing is diagnostic. Confusion, disorientation, drowsiness, signs the brain is being affected. If untreated, DKA can progress to stupor or coma. If you see severe abdominal pain, persistent vomiting, fruity breath, or confusion, go to the nearest emergency room immediately. Do not wait. Seek immediate medical attention. In hospital, you will receive IV fluids, insulin, and close monitoring of electrolytes and vital signs. Prevention includes a sick day plan. Check blood sugars and ketones frequently, and contact your care team early. Family members who know the signs can act fast, and fast action saves lives. Remember the warning signs. Act quickly. A diabetes diagnosis can feel overwhelming, but you are not powerless. Education and a care team, doctor, dietitian, diabetes educator, are essential allies. Tools like CGMs and insulin pumps and connected apps make management more predictable and safer. Healthy meals, regular exercise, and routine monitoring are the small daily wins that add up. Seek support, celebrate small wins, and learn from setbacks. Persistence beats perfection. With knowledge, tools, and support, people with diabetes can live long, healthy, and fulfilling lives.